for me.
What are your what's your advice to medical students interested in ophthalmology or getting involved or working with the department?
Yeah, well, I mean, I think the earlier you're sure about ophthalmology, the better. One of my friends at med school knew from, I think he was like second grade, he wanted to be an ophthalmologist, and so he had a great application and he matched a great program. But I think the earlier you know, the better, because then you could get involved with ophthalmology, really be sure. And you know, I came into med school after having a roommate that was blind, so I knew I was kind of at least interested. But my girlfriend's father in college was an ophthalmologist, and that also made me a little interested. But I still didn't come in thinking, oh, it's going to be ophthalmology. In fact, I was at the gym, at the med school gym lifting, and I worked on bench presses with a guy, and when we spotted each other and started talking, turned out it was Bert Glazier, famous retina specialist, and had a basic science lab at Hopkins. And I said, this was my first year of med school, and I said, well, I actually entered as an MD PhD. That's another story. And he said, oh, well, my lab's open this summer, and I said, oh, well, I'm looking for something this summer. And he said, well, work with me. And I said, okay. So I started working in his lab at Wilmer, and worked there for like 2 years, summers, but also during the med school years, and scrubbed in cases with him and so, et cetera. And so, as he said, actually, about cataract surgeons, he said, the problem with cataract surgery is that if you have to make a decision, it's because you made a mistake. So I said, okay. So I pretty much was sure I wasn't going to be a cataract surgeon, but of course he was a retina specialist. So anyway, so that's how I got interested early on. Most people won't have those experiences probably. So
go to the gym.
Yeah, go to the gym. The moral of the story, go to the gym, the med school gym. So I think the earlier you can be interested, obviously, the earlier, the more experience you can get that helps you decide for sure you do want to do ophthalmology. But if you're doing ophthalmology, then it's easier to get letters from ophthalmologists and so on. So I think that's nice. Now, that said, clearly you don't have to know from second grade that you're going in ophthalmology, but then you better do well in med school because it's competitive. There's no question that ophthalmology residency is competitive. So you want to do good in your classes, you want to get good letters, and you want to pass part one of the boards and do well on part two of the boards in the future.